The medical community is consistently doing its best to serve those suffering from addiction. I'm Sarah Blakely, your host for the Portage Health Foundation Addiction Series. In this episode, we'll hear from Dr. Adam Frimodig from UP Health System about what medical treatments are available to help those who are suffering from addiction.
With alcohol and benzodiazepines being deadly, we need to wean them down appropriately using medication. Ideally, if somebody could say, I'm going to drink one less shot every day for the next 3 weeks and then I'm going to be done, that would work too, but it doesn't work that way with addiction. So we give them medications to substitute the alcohol, and they can withdraw safely over a period of 3 to 5 days. In the setting of opioid abuse, there is no way to completely alleviate the symptoms, which range anywhere from gastrointestinal symptoms, so diarrhea, nausea, vomiting, muscle cramps, fevers, chills. And what we're doing then is symptomatically treating these so that yes, you're still going to have withdrawals, you're not going to feel great, but we can make you feel less bad so that it's a little bit easier to get through. And then when you're done, you're done. You never have to go through it again if you can remain sober at that point. So that's the first thing to get somebody in, to one, realize if they need medical attention to do it safely, and two, to help people out to get through that time in their life. After that, the role of an addictionologist is one, to identify if there's underlying conditions such as anxiety or depression, which substance use alone can cause that, but there may be already depression prior to substance use that we need to treat because they are actually just self-treating with whatever medication or drug or alcohol that they were using at the time. So identifying underlying conditions, doing a health survey to see is liver working well, kidneys working well, anything else that we have to address that might be an issue. And the other is to do something called MAT therapy, or medical assisted treatment, for helping. So there's medications that will block alcohol and opioid receptors so that if somebody were to have a relapse, because relapse is part of this disease. Every time I see somebody, I hope and plan that they're never going to use again, but by a pure numbers game and knowing this disease, a lot of people are. But what we can do is we can have a blocker for that switch in the middle of that brain. So if they have that moment where they don't care and they pick up a beer or they go and take a pain pill, that switch doesn't turn on. And they're not back in that cycle. And they can call their addictionist, they can call their counselor, they can go to an AA or NA meeting, whatever their safety network that they set up is, they can go back and work that without getting stuck in that cycle again. And there's a lot of other medical assisted treatments, but those are the ones that I tend to stick with.
Thanks to Dr. Frimodig for sharing your insight and for being an advocate for those suffering from addiction. While medical treatments help, it's still important to understand the devastating effects that addiction has on our community. In episode 8, we'll talk about those effects with 3 care providers in Michigan's Keweenaw Peninsula. If you or someone you know is struggling with addiction, know that there are resources available in our community. Dial Help is a great place to start. They have a crisis line 24 hours a day, 7 days a week, based right here in the Copper Country. Just dial 906-482-HELP, text 90635-NEEDS, or chat live with someone at dialhelp.org. If you're in any kind of medical emergency, dial 911 immediately. To learn more about the resources available in our community or to subscribe for email alerts for future episodes, just visit phfgive.org/addiction.